Dr. Lucian Leape, who is often referred to as the father of patient safety. Dr. Leape is an extraordinarily highly regarded professor at the Harvard School of Public Health. He has been an outspoken advocate for patients and for the kind of system-level changes we need to make in our healthcare system in order to prevent medical errors and improve the quality of patient care. He's one of the original founders of the National Patient Safety Foundation and the Massachusetts Coalition for the Prevention of Medical Error, and he served on the Institute of Medicine committees that led to the groundbreaking reports which really kicked off this movement for patient safety, To Err is Human in 1999 and Crossing the Quality Chasm in 2001. We really owe an enormous amount to Dr. Leape for shining the light on this important issue, one of the first people to do so and one of the most tireless leaders in this area. So Dr. Leape, I'm going to turn it over to you, and I thank you for being with us today.
Well, thank you, Deborah, and thank you all of you who have tuned in. I think it's a great opportunity to make some real improvement in the quality of care. I think most people first thought of patient safety when that Institute of Medicine report came out in 1999. It really was kind of a shot heard around the world because it said that 98,000 people a year were dying because of medical mistakes. But the second message was this isn't because of bad people. It's because of bad systems. Next slide, please. And if you look at it, it turns out that although there are literally millions of people being injured in hospitals, most of these are preventable. And the cause of the injury isn't carelessness or incompetence. That's the way we used to think about it. But it's because of bad systems. That is, things that make it possible to make mistakes, like, say, two medicines that have names that sound very similar or packaged in a similar way. And so the main thrust of that report, and really what we've been trying to do ever since, is that if you want to keep people from being hurt, you have to redesign your systems. You have to make it so it's hard for people to make a mistake and easy for them to do it right. Next slide, please. I think overall, in the, I guess now pushing almost 12 years since the Island report, we have to say it's been a great success story. Every hospital now has a safety program. Next. Hospital mortality has been going steadily down for the last 10 years. Now, that's not all due to safety, but certainly that's part of it. We've had a significant increase in funding from the government through the Agency for Health Research and Quality, and you'll hear from its administrator, Carolyn Clancy, shortly. Next. The National Quality Forum, which probably most of you have not heard of, most doctors haven't, as a matter of fact. It's not a governmental agency. It's a private organization that brings together all the stakeholders, people, doctors, nurses, hospitals, insurance companies, everybody. They have, for the last now 10 years, been working on and making available to us the information about safe practices. There's new ways we can give care, new practices that have been proven to make a difference, things that are possible for any hospital to do, and most of them really don't cost very much. And so part of what we've been trying to do is implement these kinds of safe practices. Next. We've had an interesting development that all over the country, people have come together, usually at the state level, in coalitions, to talk about how they can work better together. We have one in Massachusetts, one in Virginia, Wisconsin, Maryland, many states. And these are people who come together, people from government, people from hospitals, people from professional organizations, to see how we can improve safety. And it's been a very impressive movement. Next. The Institute for Healthcare Improvement, again, a private, not-for-profit organization founded by Don Berwick, who is now the administrator of Medicare and Medicaid, has been a major contributor to this, training most of the people in America who have learned about quality improvement and safety have learned it through IHA courses or programs. And they had a very exciting 100,000 Lives campaign in which they got 3,000 hospitals to set out to try to implement 6 safe practices, and they not only achieved their goal of saving 100,000 lives, they exceeded it. They saved over 120,000 lives. Next. And finally, the Joint Commission, which is the organization that accredits hospitals, has put safety front and center in its efforts. And every year they announce new safety goals, which are really let's implement known safe practices. So there's been a tremendous amount going on. Next, please. And I want to just tell you two examples that I think are very exciting. The first is what happened in Michigan a few years ago. Peter Pronovost at Johns Hopkins had shown it was possible to eliminate infections from central lines. Central lines are little plastic catheters we stick in the vein and push it in towards the heart, used to draw blood and give medicines and so forth. It turns out that too many of them get infected, and sometimes those infections are fatal. And then also patients that have infections when they are on ventilators, when they're being breathed by a machine. Deborah talked about and showed you some information about how many people suffer and die from hospital-acquired infections every year, and it was a total cost, I think she said, of $25 billion a year. Well, two of the most serious are central line infections and ventilator-associated pneumonia. So Peter Pronovost, with the help of the Michigan Hospital Association, enlisted a bunch of hospitals to see if they could eliminate these infections. Next. And they showed that they were able, by putting in checklists and protocols, 68 hospitals were able to go for 6 months without a single central line infection or a single episode of ventilator-associated pneumonia. This is really very exciting. They had totally eliminated these two deadly infections for more than 6 months. Next, and they estimate, based on their previous experience, that in that 6 months alone, they saved over 1,500 lives. Next, reduced hospitalizations by 81,000 days. And next, saved $165 million. Now, that is two conditions in 68 hospitals in one state. Multiply this by hundreds, and you can see how we could easily save more than that $25 billion. I think it's quite clear. This is just one example, but all kinds of complications and injuries from treatment are expensive. They're of course, the most serious thing is they harm people, but in addition, they cost a lot of money. And clearly, making health care safe is the best way to reduce health care costs, and we know how to do it. The next slide is another example, and this is the work of Atul Gawanda that many of you may be familiar with. These are results from an international program in which they implemented a surgical checklist, going through checking to make sure you have the right patient, you're operating on the right kidney, that you've got blood in the room, you've got the x-rays, all that sort of stuff, making sure everything's all set before and during surgery. And they showed that by implementing the surgical checklist, they were able to reduce surgical complications by over 40% and deaths by almost 50%. Dramatic impact. And now people are implementing this surgical checklist throughout the entire country. American College of Surgeons has made it an objective, and many states are going for 100%. So these are a couple examples of some really impressive gains, and I think we really should be proud of what we accomplished. However, when you look at the overall information, next slide, and some recent studies, it's kind of discouraging. The Office of the Inspector General reported last fall of a review of Medicare patients, and they found that even now, that 13.5% of these patients had serious adverse events. Adverse events are injuries caused by treatment, and that nearly half of those were preventable, but they estimate that as many as 180,000 Medicare patients are dying from these every year. Next, another study done in North Carolina looking at a new way to identify adverse events called a trigger tool, which is just a sophisticated way to do a record analysis, what it is. And they found numbers very similar. 15% of patients had serious adverse events, and nearly 2/3 of those are preventable. So this is really kind of discouraging. With all this work and some of these big hits, the fact that we still haven't really made a major impact overall. And so the obvious question is why is that with so much effort? Why don't we have more to show for it? Next. I think the thing that's been most interesting is that what we've learned is that making healthcare safe isn't just about putting in safe practices and filing reports and following protocols. Next slide. Next item. It's really much more about working together in teams, working in interprofessional teams, doctors, nurses, technicians, physician assistants, pharmacists, and so forth. And in order to do that, people really have to work well together and respect each other. Unfortunately, we don't teach teamwork in medical school, and so people have had to learn it on the job, if you will, and we've been rather slow at getting to it. Next. But teamwork is the secret of success for every industry that has succeeded in becoming safe. We all think of aviation when we think of something that's safe, and sure enough, it's true. When you get on an airplane, a commercial airliner, you're not very worried about dying because the accidents are so incredibly rare. But one good example of teamwork is something I think most of you will remember, a picture we saw in the paper just about 2 years ago. Next. And this is U.S. Airways 1549, which Sully Sullenberger deftly landed in the Hudson River when both of his engines were disabled by birds. And here they are on the river, and all the people have gotten out, and they were subsequently lifted into boats, and not a life was lost. A few people had wet feet, but it was really pretty impressive. And what it was is he was the first to say not just that he was a brilliant pilot, he of course was, but it was teamwork because the co-pilot managed the plane while he was steering it down. The attendants got people ready. The attendants helped people get out. Everything worked like clockwork with a team that had never before ditched an airplane. But they knew what to do because they had trained as a team. And that's exactly what we need to do more of in medicine, not just for safety, but also for the everyday care of people with chronic disease that Deborah mentioned. We can do so much more to improve their care if we learn to work together. That's what we're after. Next. So what we're really saying is in the last analysis, what we're trying to do in patient safety is change a culture. Our hospitals, our healthcare organizations haven't been oriented around safety, and so we're learning how to do this. And the first thing is what the Institute of Medicine said 12 years ago. It doesn't make sense to punish people for making errors because the errors are not because they're bad, it's because of bad systems. We have to have a transparency. We have to have a situation where people can feel free to talk about their mistakes, and patients certainly have a right to know what's happening and what's going on. We need to be honest and upfront. We need to work together in teams. We need to be accountable not only to each other and to our institutions, but primarily, of course, to the patient. And we need to orient all our efforts around the patient. So what we're talking about is a lot more than just implementing a few safe practices. It's really undertaking a major culture change. Next. And what we're talking about today, the Campaign for Better Care, that's exactly what it's about. It's part of the larger initiative, the National Patient Safety Initiative, announced just a month or so ago by HHS, $1 billion to help hospitals and health organizations improve patient safety. A cornerstone of that are collaborative networks such as the Campaign for Better Care. And I think that the time has come for us to learn to work well together. It's time for all hospitals to get on board. It's time for all hospitals to do what some hospitals have shown is possible. Really, how can we do less? So I encourage you to use your influence to help hospitals really move ahead and doing what we now know to do and get on with the job at hand. Thanks very much.